Hey. Hey. How you doing? Good.
Team, thank you for joining me here today. We've thoroughly reviewed the case of Jason Hollis. This included interviews with all of you. Jason, as you know, was born with congenital heart disease that required placement of an artificial conduit at birth. At 18, on our recommendation, he agreed to have that conduit replaced. It seems clear to us that although the surgery was performed correctly, the sutures used for the anastomosis, unfortunately, pulled through the vascular tissue shortly after he arrived at the PACU. And despite the team's heroic efforts, he died. Again, after careful review, we've concluded that in this case, although the results were tragic, there is nothing that would warrant financial compensation. Still, the family needs closure.
Nothing? You've got to do something for this family. I performed both surgeries on Jason. His family sends me a birthday card every year. The kid was months away from starting college. Really? Nothing?
Mike, we've been through this. No one can identify a single thing we could have done better in this case.
But you have no idea how hard this has been on me.
Mike, I know this has had a dramatic impact on you. And if you want to talk further about your personal feelings about this case, we're here for you and can support you. But let's do it after this meeting. Right now, we're here to talk about the family.
Okay. I hear you.
All right. Over the past several weeks, we've communicated with the family multiple times, during which we've shared portions of our extensive investigation. They've got some idea of the direction, but now it's important for them and for us that we draw this to a close and share our full findings. I'd like everyone in this room to participate in a meeting with the family.
No disrespect, Danielle, but are you serious? Their minds are already made up. A lawsuit is their next likely step. I don't think it's a wise decision to give more information for them to use in their lawsuit.
There's no guarantee that talking with Jason's family will lead to a different outcome, but I've been down this road before, and I've witnessed many more positive outcomes than not. I do know one thing for sure. The likelihood of us getting sued goes way up if we don't try. This represents the best chance for giving the family the closure they're looking for, so they're not forced to look to lawyers for answers. We'll definitely fail if we don't try.
I'm for trying, but all the signs are pointing to us getting sued. Mr. Hollis is very angry.
Even if the family sues us or complains to the state medical board, they deserve closure. And like it or not, that's what we're about here. That's the culture of this organization. We can't control how they're going to respond, but we can control whether we do the right thing.
Danielle, you have no idea how important it is to all of us to do the right thing. Wes, if it's all the same to you, I want to have this conversation. We need to have this conversation.
I never thought of it like that. I guess I've been reluctant because I've never been in a situation like this before. But I guess if I were in the family's shoes, I'd want some answers too. Okay, I'll give it a chance.
Thank you, Wes.
We're all in agreement then.
Yeah.
What's next?
All right, here's how we'll proceed. I'll structure a conversation with the family. On the day of the meeting, our team will assemble in the room 30 minutes ahead of time to make sure everyone is ready. I'll assign seats to each of you at the table. Then I'll bring the family in and introduce everyone. It's important that you behave in a respectful manner. For example, please don't bring food in with you. It sends the wrong message.
Not even a cup of coffee?
No, it sends a message of nonchalance. Also, please schedule an hour for this meeting on your calendars. It's important that we avoid any distractions so that we can give our full attention to the family. Also be aware that in these situations, the family may bring a lawyer unannounced, or they may tape record the meeting without telling us in advance. I just want to prepare you for that.
Thanks for the heads up.
Yeah, thanks.
Yeah, thank you.
Okay, So right now, I'd like to review with all of you the issues the family has raised and we've raised ourselves. As you all know, we've investigated this extensively. We've had external reviews, internal reviews, and reports about the conduit from the manufacturer. You've all seen the draft investigation report.
Correct.
All right, let's go through the issues chronologically. On the question of whether or not the surgery should have been performed in the first place, Mike, you've explained to me thoughtfully about why Jason needed the new conduit sooner rather than later.
Yes, that's true. But Mr. Hollis is beating himself up about not talking his son out of the surgery.
I think that's very much part of this issue. Often people in pain lash out with accusations as a way of dealing with their own guilt feelings. And even though we wish we could turn back the clock, our investigation has found there's no reason, even in retrospect, that anyone, his father included, should have talked him out of that surgery.
Agreed.
Mike, can I look to you in particular for a clear, unambiguous statement on that? I think it would really go a long way to helping this grieving father.
Yes, I can do that.
Okay, great. Now, let's continue to review the other issues and talk about how best to handle them. Okay, now that we've gone over these specific areas of concern, let's be clear about who will address each. In talking with each of you, I'm aware that you're all hurting too. We're in unison with the family on this. And though it's not about us right now, you should all be honest about your emotions. It's not wrong for them to see how this has impacted you. You can be sensitive to their grief without spending time blaming yourselves. Mike, you know that Mr. Hollis has been angry that you didn't attend the funeral. I'd like to meet this head on, and I'd like for you to explain why you weren't there. You've had a close bond with this family, and as painful as it might be, addressing this openly will begin to reestablish that 18-year bond. You've explained to me how important it was for Jason to have this surgery, so drive home the point that the older Jason got, the more complicated this procedure was going to be for him.
Okay.
Finally, I need you to dispel specific concerns expressed by the family. Were the sutures improperly placed? Did you have any reason to think that the cardiac tissue was going to pull through once this patient was reperfused?
Got it. Should I talk about my post-surgery conversations with the manufacturer about the graft we used?
Yes, and you can talk about the many cases you've done, the care with which you placed the sutures. Just be clear, be honest, be compassionate, always show empathy. That goes for all of us. Oh, and be aware that Mr. Hollis may ask additional questions. He's asked a lot of questions since his son's death.
What if he asks a question we can't answer?
Don't answer it if you're unsure. We can always tell him we'll get an answer to him later.
Okay. So how do you see my role in this meeting?
You'll address what happened to Jason once he was moved to the post-op recovery unit. You'll establish that he was hemodynamically stable, although not fully reperfused.
That's correct. The nursing team was completely sure that the patient was fine.
I was the one that moved him from the OR to post-op, and his vitals were good and strong. And then all of a sudden, that changed.
Megan, I'd like you to add to Michelle's comments related to the patient's initial stability. Your role is unique. They see your actions as heroic. Opening Jason's chest right in recovery to stop the bleeding. The family empathizes with you and the position that you were put in on that day.
I know, but I'm in complete support with the decisions made by Mike.
Good. Feel free to express that support during the meeting. At some point, I want to turn the discussion to any lessons we might learn from this tragedy. The question of whether the chest could have been left open until the patient was completely reperfused may be brought up. And Wes, this may be a good time for you to talk about the challenges of managing blood pressure and the practical problems of managing post-op with a wide open chest.
I can do that, but I have to ask again, what if we get into this room, the father becomes agitated, and the discussion becomes heated?
My role is to control this meeting. If at any time, and I do mean any time, you feel uncomfortable, all you have to do is signal it by looking directly at me and nodding your head, and I will end it. By the same token, when I say we're done, we're done. Please don't question it, don't argue, just get up and leave.
Well, I'm glad we met today and discussed this. I have a much better understanding of what we plan to do and how this really is in the best interests of all concerned.
I'm glad you feel that way, Wes. Any other questions or concerns?
No?
Once again, I know Jason's death affects each of you, and this can't be easy. I'll update you with a meeting location, date, and time. If before then you have any questions, please don't hesitate to call. Otherwise, I'll see you at the meeting.